Hey guys, this is Dr. Marcy. If you haven't seen me in a while and you've forgotten what I look like, this is me. And I wanted to just do a quick, almost like a letter to my patients and to my clients. And part of that is because there's been some confusion about an email I sent out regarding the member based care plans. And I want to just kind of go over the last really 10 years, because it's been 10 years since we opened, and how we've changed and how we plan to move forward in the future so that we can best serve you and serve each other. So, 11 years ago, I opened my own business because the place that I was working at the time and I no longer had ethics that aligned. There was a discrepancy in the allowance of me using some vacation time for a personal family matter, vacation time that I had available, but was then told I could not use to care for my then 7-month-old son. And it was time for me to move on. I had outgrown that space. Unfortunately, there were some really great people who worked there, but it just didn't work anymore. And so I opened my own clinic in the summer of 2011. And many of you have been with me even since before that transition. And we grew very quickly. And then in 2014, there was a shift in the market in the Denver metro area where a lot of orthopedic surgery groups and physician groups started opening up their own physical therapy clinics and doing what we call referral for profit to their own physicians owned centers. And we started kind of slowly downsizing. And then in 2019, I made the decision to go solo. And part of that was because I was at a point where I needed something different. The way that I was practicing was still getting me what I wanted, which was to help people, but I wasn't able to do it in a way that served my heart and my soul because insurance companies kept saying, nope, you have to do it our way. The biggest way that showed up is that I had a client who the surgeon that evaluated him said he is not a candidate for surgery. We need him to do this particular rotator cuff protocol. That protocol came from the Cleveland Clinic. And if you don't know anything about the Cleveland Clinic, it is one of the premier orthopedic sports medicine centers in the country. And they developed this protocol in 2017. And this was in 2019. So I was using the best evidence-based practice that I could to help this gentleman recover without surgery, which long-term would save the insurance company over $40,000 in surgery fees. And we originally got a pre-authorization approval, started billing under that pre-authorization, and got denied payment for non-medically necessary services. We filed an appeal, spent over 100 hours on that appeal, and then in the end, lost the appeal. And so the patient became responsible for all of the billing anyway. And to me, it just served to show that even though I was doing exactly what I should be doing for this patient, the insurance companies didn't care and they didn't actually want people to get better. And in fact, a conversation that I had with the case manager for that particular appeal said, our job is to get them to 70%. That's it. Well, I don't know about you, but I don't want to function at 70%. I want to function at 100%. And so in May of 2019, I made the decision to go out of network with all of the insurance companies I was in network with the exception of Medicare, at the time Medicaid, TRICARE, Veterans, Community Choice Plan, and CIGNA. And since then, I have also let go of the Medicaid contract. I've done a lot of searching about what I really want to do and how I can best serve people. And with everything that's happened in the health community and in the community in the United States since March of 2020, I feel like where I can best serve people is by establishing health for all the people I come into contact with. And that's not just your physical health, that's your mental well-being and your emotional well-being. And I can't do that just being a physical therapist. Many of you have experienced some kind of health coaching from me over the years, where I've given you recommendations for different things that you can do for your health. And you have said that you have enjoyed that and that has been a good experience for you. And my goal by the end of 2022 is to be seeing more health coaching clients than I am physical therapy clients. And that's not because I don't enjoy working with you as a physical therapist. It's because I know I need to be doing more for my community in terms of establishing a baseline of health for people that I work with. And that baseline of health, unfortunately, is not covered by the insurance companies. And I don't want to be handcuffed by third parties to give you what I know is the care that you need and deserve. So I developed the membership care plans this year. And part of the reason for that was because Medicare did another payment cut in reimbursement to participating providers. And I don't know if you've been following it or not, but this is the 5th annual cut in reimbursement to providers from Medicare that we have sustained. And it was a cut of 7%, 8%, 6%, 9%, and now 4%. And on top of that, in 2013, they started doing a 2% sequestration for administrative fees so that they could cover their own administrative fees that they've put in place because they're having your physician do a wellness visit every year and a drug check visit every year. And because they're having us fill out these things called G codes, and because they're having us now do the senior depression scale and those things, they have to have a way to then reach out to people when that information comes in and use it. And unfortunately, what we've seen is that a lot of private practices have closed their doors or they've let a larger group buy them out. And what that looks like is a lot of primary care providers have gone to either SCL Health, they've gone to Health One, they've gone to Centura Health, or they've gone to University Hospital. Best example I can give of this in the physical therapy community is that a large clinic in the area got bought out by Benchmark Physical Therapy, and they bought all 9 of their practices. And then the Steadman Hawkins clinic that was in the Denver Metro Tech Center area was bought out by University Hospital. So 2 large examples of even private practice physical therapy being purchased by large commercial groups that are mostly numbers focused, not outcome focused. And that's seen in that, and I have talked to people who've worked at both places. The physical therapists are scheduled on average 4 to 6 patients an hour. And to me, that's not quality care. And I see some of those patients because they come to me after they've had care there, and we work with them for 3 or 4 visits, and they're better. I know what I have to offer is different because I'm seeing different results. People get better faster than the average. And part of that is because I've continued to offer my health coaching for free. So the membership plans, if you are on an insurance plan and you're coming in, the membership plan is the plan that is the best fit for you because it allows me to do all of the extra things that I do, like trigger pointer needling and laser, and include that in your care. If you don't want to do the membership plan and you still want to come in for care, that's fine. The price for your appointment will be slightly higher so that I can still do the things that I want to do. I will bill your insurance, but you will be responsible for the difference in what your insurance reimburses and what we do on that date of service, particularly when we use a modality that is not covered by your insurance. Also, for my CIGNA clients, I'm moving to hour-long appointments, which means that you will pay the difference between your appointment and what CIGNA covers. Because for me, the ability to give quality care is more important than what your insurance company says I'm allowed to do. You can schedule a one-off visit. The cost of that visit is priced at a non-member price. If you're a cash paying client and you come in, you don't need a membership plan. There are other options to decrease the cost of each visit at that point. And with my cash-based clients, I use all of the modalities that I have available. Now, the wellness packages, there are some packages there. And I know that those prices looked fairly steep and like it was your only option. It is not your only option. You can come in and do a quarterly visit. You can come in and do a biannual visit. And we can cover things like, what are you taking in terms of medications and supplements? And how can we adjust that to make sure that you're getting the best out of what you're taking and also not having to take as many pills so that you don't end up with pill fatigue. If you want to do one of the packages that are there are listed there because they're things that I feel like most people struggle with. So the primary signature package that I am running in 2022 is regarding changing your mindset, looking at the way that you view food as either addiction or entertainment or nourishment, and trying to find a way for you to find healthy balance in your body in regards to that. It's a 12-week program. It comes with group coaching that is weekly. And it comes with some worksheets and homework for you to do so that you can kind of discover where your hangups are. And everyone who has done that program has lost a minimum of 15 pounds, every single person. I've had some people lose as much as 29 pounds. I've had some people lose 17 pounds in 12 weeks. And the best part about it is I'm asking you to change one thing. The workout involved in it is going for a walk for 20 minutes. It's not a big commitment. The other program that I'm running, it is 6 months, and that's because typically it actually takes people 10 months to get through this program, but it is 6 months of a gut cleanse. Now, why a gut cleanse? The way that issues with our gut show up, gas, bloating, belching, GERD, acid reflux, headaches, skin rashes, constipation, and then diarrhea, the inability to sleep, headaches, joint pain is another really big one. And all of those things lead to further dis-ease in the body. And one of the things people don't really pay attention to is that those disorders can also cause things like malabsorption disorders, which then can lead to heart disease. So if we can fix what's going on in the gut through a simple program, we can fix the overall health. So that program is priced a little bit higher, and the supplements in that program are extra, but it is a program well worth doing. Now, there are some other programs that are priced fairly inexpensively. It's basically the cost of my time plus your supplements. And it depends on how much contact you want to have with me. So if you want unlimited access to me, you're going to pay a higher premium. If you just want to do the program on your own, you can do those plans for as low as $300. So there are options in between, and you can schedule one-off visits on the wellness plan as well. But there will be the option as well, if a member needs the appointment time, for me to reschedule you because I am making the members a priority. I know for some of you, this doesn't seem reasonable, but when you look at everything that's happening in healthcare and the healthcare practices that are primarily still self-owned, they all have one thing in common. They're moving to not taking Medicare. They're moving to taking fewer insurance company plans, and they're moving to membership-based care. I hope this helps explain some of the issues that we've come up with. And if you have more questions, please shoot me an email. You have my contact information, or you can respond to this email. If you're interested in learning more about one of the wellness programs, I will attach a link in this email so that you can book a discovery visit and a strategy call so that we can determine which program for your overall wellness is best for you. If you know someone else that's really struggling with their health and you think that they would benefit from one of the wellness programs to improve weight, to improve blood pressure, to improve their cardiovascular health, to improve liver health, kidney health, I'm happy to have a discovery visit with them. Just forward them this email. Thank you and Happy New Year.